and it was to maintain tissue integrity. It was not to interfere with the treatment. That is not the process, and consequently I put it into an aloe vera gel base. And many physicians give you a list, do they not, when you're going through radiation, say, don't use this because it can promote extra burn. And
right. They say no deodorants, they say no oils, they say no creams, they suggest that you use aloe vera to offset the effect of the radiation burn. Mm-hmm. And that's all they want you to use. And there's nothing wrong with aloe vera, but maybe not quite enough in this situation where the radiation goes deep. And like Gail said, cumulative too.
Yeah, and aloe vera is a wonderful healer. It's an astringent. It can help to retighten the skin. It can help to heal it faster, but it does need an extra oomph. Mm-hmm. Especially when you're being bombarded on a daily basis, as you were. The average treatment seems to be between 20 and 36 treatments, and sometimes using a shield, which increases the radiation towards the end of the treatment protocol as well. So it's really important to maintain that. So what I have found, depending on the number of treatments, when you start, etc., there are certainly deciding factors. Once you start radiation, that radiation immediately becomes cumulative in your tissues. So if you came to me, say, at your 6th treatment and said, I want to use this cream, will it prevent me from burning? Well, the chances are that you've already begun the burn, because your skin will probably begin to turn very light pink. Right. But what happens is it greatly reduces the burn and the pain and the discomfort and the fissures that can develop and things of that nature. And you can use it in a slightly different manner too, both before radiation and then after radiation, to help that skin heal as well. So, your results will vary depending upon whether or not you've already begun radiation and if you follow it, step by step. In the, I would say, probably 11 years that I have used this cream, and that others have used it for various forms of cancer, people have experienced everything from absolutely no burn, and I do have testimonials to that effect, to very slight burns or a slight pink, almost kind of like a bad sunburn, more than anything. But I've yet to see anybody have those deep fissures in the broken skin and that really raw, meaty kind of look that people have. And for people who've already gone through their radiation, and they said, like, I've already had my radiation and I got really hurt and it's so sensitive and things of that nature, well, then the blend becomes different, and you still use an aloe base because aloe, of course, is very healing. You want to be really careful what you put on the breast. But we change the oils so they're anti-inflammatory and they're antibacterial. So, you hope to prevent any kind of bacteria from invading those fissures, and you take it to, some of the oils have analgesic properties, so it helps with the pain. So there's a way to look after a radiation site before it's radiated, and then again afterwards. So what was your experience with the cream?
My experience was wonderful. I didn't experience hardly any, and I'll say that my skin did get pink, it got a little bit red, and especially, as Gail said, it's cumulative, so even once you're done your radiation, that seems to be, in layman's term, when your skin really starts to cook, basically, and then the physical aspects of the burn really come out. While I was going through radiation, I didn't have that. I had pink. My skin may have been sensitive, but not really. I guarded it. I kept it covered. I went through radiation in the summer. Of course, I didn't go out in the sun, but I didn't have half the physical aspects or the symptoms that I saw the other woman when I was staying at the lodge. Their burns looked severely worse than mine could ever, with the actual deep burns to the red, like a bad sunburn, but also some of them, like you said, their skin, because if the radiation's here, they're usually radiating here to here, and it seems to creep up through the neck, and they would have open sores and deep brown color, like a bad burn, a real bad burn. I didn't experience any open skin. I had sensitive skin, and I didn't get a lot of what I was seeing from the women after the radiation was done, the cumulative effects afterwards. It just seemed to stay a pinky color. Nothing really severe from my aspect, anyway.
And that's great because you'd already had some radiation treatments prior to using the cream. So you came in a little bit farther down in your treatment and had a lot of treatments, particularly because of the double tumor, because they were both different markers, were they not, in your tumor. So for you, it made a big difference in how comfortable you were in going through that too. You were away from home, which can be also a vulnerable, isolating feeling as well. And one of the essential oils that is in this particular pre-radiation cream is supposed to help with that. There's an essential oil that helps you to feel a little more calmer, and it's an oil that's been used for centuries for beauty care and for maintaining lovely skin. And the nice thing about it is that you remain cancer-free today, do you not?
Yes, I do.
Yes. So we're talking, how many years is your diagnosis now?
I was 5 years in November, that wonderful critical time that everybody likes to celebrate.
Yay.
And so I'm into my 5th year, 5.5 almost, of cancer-free.
That's terrific. And I'm not saying necessarily that the cream made you cancer free. That's not what I want to point out. What I want to point out is that it did not interfere with your treatment.
Correct.
And that is the crucial aspect of things, because when you go to a physician and you say to an oncologist, particularly radiation oncologist, I want to use this cream. I really don't want to burn. I want to maintain my body as best as I possibly can. And you know, this is what is in it, and I provide a sheet that you can take to your radiation oncologist that explains why I use these oils and what properties they have, and there is good research behind them. This is not something that, you know, you take a weekend course and say, oh, I'm an aromatherapist. You know, you take a very in-depth anatomy, physiology, pathology. We take organic chemistry. We need to know about all of the body types. We need to know about the pathology of cancer. We need to look at people who have chronic and disabling diseases, and we need to know how the essential oils have both a pharmacological, physiological, and psychological effect on the body, and how it's metabolized through the liver. So this is actually both an art in the blending and a science in knowing how these work. And what doctors have or scientists in particular, have found is that there are two very crucial components in some essential oils, citruses in particular. So eat your oranges and your lemons and your limes. Is one of the reasons why I advocate a lemon or lime in hot water every day, is that they contain a substance called D-limonene. And D-limonene has been known to actually turn off the tumor gene or the oncogene in the body, and it helps to reduce tumors. That it creates an alkalinity in the body that is very crucial for getting rid of your cancer or keeping cancer free, because the body at a pH of 8, cancer cannot live in that environment. It's too alkaline for it, and it's an acidic disease.